Did you know that every 40 seconds, someone in the US has a stroke? And the scariest part? Many people don't even know they're at risk until it's too late. Today, we're going to uncover the truth about strokes, a condition that can steal your ability to speak, move, or even survive within just minutes. But here's the good news. Knowing the early warning signs and how to prevent a stroke could actually save your life or the life of someone you love. In this video, I'll walk you through exactly what a stroke is, what causes it, the silent symptoms that are often overlooked, and 5 simple steps you can take today to lower your stroke risk. Don't look away. The knowledge you're about to gain could mean the difference between a healthy future and facing devastating consequences. Disclaimer: the information in this video is for educational purposes only and should not be considered medical advice. Always consult a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment. What is a stroke? Understanding the hidden threat to your brain. Imagine your brain as the ultimate control center of your body, governing everything from speech and thought to movement. To work properly, your brain needs a constant supply of oxygen and nutrients, which it gets through steady blood flow. Animation: show the brain with blood vessels. One vessel becomes blocked or bursts, and part of the brain darkens, representing damaged cells. A stroke happens when that blood flow to part of your brain is suddenly disrupted or severely reduced. When this occurs, brain cells begin to die within minutes due to a lack of oxygen and vital energy. That's why every second counts in a stroke emergency. In medicine, there's a saying, "Time is brain." The longer you wait, the more brain tissue is permanently damaged, and the harder recovery becomes. The 2 main types of stroke. Knowing the difference could save your life. A stroke can occur due to 2 primary reasons. Think of them as 2 dangerous culprits attacking your brain. 1. Ischemic stroke, blocked blood flow. This is the most common type of stroke, accounting for about 87% of all cases. Think of the blood vessels in your brain like the water pipes in your home. If one of those pipes gets clogged, water can't reach its destination. The same thing happens when blood flow to the brain is obstructed. An ischemic stroke occurs when an artery supplying blood to the brain becomes blocked, usually by a blood clot. That clot may form right at the site due to a buildup of plaque from atherosclerosis, or it may travel from another part of the body, such as the heart, and lodge in a critical artery. This kind of stroke must be detected and treated immediately to avoid permanent brain damage. 2. Hemorrhagic stroke, bleeding in the brain. Dangerous and unpredictable. Unlike ischemic strokes, hemorrhagic strokes are less common, but they're often far more severe and leave lasting damage to the brain. This type of stroke happens when a blood vessel in the brain ruptures or leaks, causing blood to spill into surrounding areas. The leaked blood not only destroys brain tissue, but also increases intracranial pressure, leading to extensive damage to nerve cells. The bleeding may occur directly inside the brain tissue, called an intracerebral hemorrhage, or in the space around the brain, known as a subarachnoid hemorrhage. To make matters worse, when a blood vessel bursts, the area of the brain that it once supplied is suddenly cut off from vital oxygen and nutrients. This dramatically increases the risk of widespread brain injury. Hemorrhagic strokes typically happen suddenly, with intense symptoms, and always require immediate emergency care. Digging deeper, what actually causes a stroke? What's going on inside your body? To truly understand how a stroke occurs, it's important to know exactly what leads to the blockage or bleeding in the brain. For ischemic stroke, the most common causes are atherosclerosis, hardening of the arteries. Over time, fatty deposits, calcium, and inflammatory cells form plaques inside the arterial walls. These plaques narrow the arteries and make them less flexible. If one of these plaques ruptures, it can trigger a blood clot that blocks blood flow to the brain, especially in critical arteries like the carotid arteries in the neck. Embolism. Traveling blood clots. Sometimes clots form elsewhere in the body, most often in the heart, especially in people with atrial fibrillation, AFib. These clots can travel through the bloodstream and get lodged in smaller arteries in the brain, cutting off vital circulation. Other, less common causes include blood vessel inflammation, vasculitis, and rare blood clotting disorders, which can also trigger strokes in certain individuals. Main causes of hemorrhagic stroke. When blood vessels break down. A hemorrhagic stroke happens when a blood vessel in the brain bursts, causing bleeding into the brain tissue or surrounding areas. Several common causes include high blood pressure, hypertension. This is the leading culprit. Chronic high blood pressure weakens arterial walls, making them more likely to rupture, especially the smaller vessels deep inside the brain. Brain aneurysms. These are balloon-like bulges in the artery wall that develop over time. If they rupture, they can cause a subarachnoid hemorrhage, a dangerous type of bleeding around the brain. Arteriovenous malformations, AVMs. These are abnormal tangles of arteries and veins, usually present from birth. The vessel walls here are fragile and prone to breaking, which can lead to brain bleeds. Overuse of blood thinners. While anticoagulants help prevent clots, improper use or injury while on these medications can significantly increase the risk of internal bleeding, including in the brain. The pathology of stroke. What happens inside the brain? When blood flow to the brain is interrupted, brain cells are quickly deprived of oxygen and glucose, two essentials for survival and normal function. The core. This is the zone of the brain that's directly affected by the lack of blood flow. The cells here die quickly, resulting in irreversible damage. The penumbra. Surrounding the core is a critical area where cells are in danger but not yet dead. These cells can still be saved if blood flow is restored quickly enough. Emergency stroke treatments aim to rescue this penumbra and minimize permanent brain damage. Recognizing a stroke. Acting fast could save a life. The Be Fast rule. When it comes to stroke emergencies, the faster you recognize the signs, the better the chances of survival and recovery. The American Stroke Association recommends the BE FAST acronym to help spot the warning signs. B. Balance. Is the person suddenly dizzy, off balance, or unable to walk straight? E. Eyes. Are there sudden changes in vision, like blurry sight or double vision? F. Face drooping. Is one side of the face drooping or numb? Ask them to smile. Does the smile look uneven? A. Arm weakness. Is one arm or leg weak or numb? Ask them to raise both arms. Does one drift downward? S. Speech difficulty. Are they slurring words, struggling to speak, or unable to form clear sentences? T. Time to call 911. Call emergency services immediately, even if symptoms seem to go away. Note the exact time symptoms began, as it's critical for treatment. Also, be on the lookout for sudden, severe headache, especially if it feels like the worst headache of your life. Numbness or weakness, particularly on one side of the body. Confusion, slurred speech, or sudden difficulty walking. Stroke diagnosis and treatment. Every minute counts. If a stroke is suspected, getting to the hospital immediately is absolutely critical. Here's what typically happens next. Rapid clinical evaluation. A doctor will assess the symptoms, perform a neurological exam, and review your medical history. Brain imaging, CT or MRI. These scans help determine what type of stroke is occurring, ischemic, blocked blood flow, or hemorrhagic, bleeding, which is crucial for deciding the right treatment path. Additional testing, blood tests and ECG, electrocardiogram, to check for heart rhythm issues like atrial fibrillation and possibly carotid ultrasound or cerebral angiography if needed. The earlier the diagnosis, the better the chance to save brain tissue. Treatment for ischemic stroke, restoring blood flow to save the brain. In an ischemic stroke, caused by a blocked artery, the emergency goal is to restore blood flow as quickly as possible to limit brain damage. TPA, tissue plasminogen activator, a powerful clot-busting medication delivered via IV. It's most effective within 3 to 4.5 hours of symptom onset. The sooner, the better. Mechanical thrombectomy. For larger blockages, doctors may insert a catheter, usually through the groin, and guide it to the brain to physically remove or suction the clot. This procedure can be effective up to 24 hours after symptoms begin in select patients. Aspirin and antiplatelet medications. These help prevent new clots from forming and support long-term protection of the brain's blood vessels. Time is brain. Act fast. Treatment for hemorrhagic stroke, stopping the bleed and protecting the brain. In a hemorrhagic stroke, bleeding in the brain, the priorities shift to stopping the bleeding and relieving pressure inside the skull, strictly managing blood pressure with medication to reduce strain on fragile vessels. If the patient is on blood thinners, doctors may use reversal agents to neutralize their effects and stop the bleeding from getting worse. Surgical options for hemorrhagic stroke: stopping the bleed, relieving brain pressure. In some cases of hemorrhagic stroke, emergency surgery may be required to stop the bleeding and prevent further damage. Surgical clipping. A neurosurgeon places a small clip at the base of the aneurysm to stop blood flow into it and prevent future rupture or bleeding. Endovascular coiling. Using a catheter, tiny platinum coils are inserted into the aneurysm to promote clotting and seal off the weak spot in the vessel wall. Craniotomy. Hematoma drainage. A surgical procedure to open the skull and remove large blood clots, relieving pressure on the brain. AVM treatment. Abnormal blood vessels, arteriovenous malformations, may require surgical removal, embolization, or precise stereotactic radiosurgery. The best option depends on the individual case, and doctors will choose the most effective method to protect brain function. Preventing stroke. Take action. Today, protect your brain. Tomorrow. Here's the good news. Up to 80% of strokes are preventable by managing key risk factors. These simple but powerful steps can make a big difference. Control high blood pressure. High blood pressure is the #1 cause of stroke. Work with your doctor to keep your levels healthy, ideally below 130/80 mmHg. Lower bad cholesterol, LDL. Reduces plaque buildup and keeps arteries open. Manage diabetes. Keep blood sugar in a healthy range to protect your blood vessels. Eat a healthy diet. Focus on vegetables, fruits, whole grains, lean protein, and healthy fats. Limit salt, saturated fats, and processed foods. Maintain a healthy weight. Losing even 5 to 10% of excess weight can significantly reduce stroke risk. Stay active. Aim for at least 150 minutes per week of moderate exercise like walking or swimming. Quit smoking. Stop today to dramatically reduce your stroke and heart disease risk. Limit alcohol intake. Drink in moderation or not at all. Treat atrial fibrillation, AFib. Take prescribed anticoagulants to reduce your risk of stroke caused by blood clots. Get regular screenings. Routine checkups and vascular screenings, especially of the carotid arteries, can catch risks early. Remember, stroke prevention starts with the small choices you make every day. Final thoughts: knowledge, action, and hope. A stroke is a medical emergency that can be life-threatening or lead to long-term disability. But the truth is, you can reduce your risk and improve your chances of recovery by understanding the different types of stroke, knowing the causes and hidden risk factors, spotting the warning signs using Be Fast, and acting immediately, leading a healthy lifestyle, managing blood pressure, blood sugar, cholesterol, quitting smoking, and staying active. Most strokes are preventable if you start today. If you found this video helpful, hit like, share it with loved ones, and subscribe so you don't miss other life-saving health tips. Have a question or personal story about stroke? Share it with the community in the comments below. Important note: The information in this video is for public health education only and is not a substitute for professional medical advice or diagnosis. Always speak with a qualified healthcare provider about any health concerns. Thank you for watching. Stay informed and take charge of your health and the well-being of those you love.